If you're dealing with knee pain, you're going to want to stick around for this video because we're going to be going over 4 overlooked but very common causes of knee pain. Hi, my name is Dr. Clay Sankey and I'm a chiropractor at TruMotion Therapy here in Charlotte, North Carolina, and we treat a wide variety of musculoskeletal complaints and conditions, everything from back pain, neck pain, jaw pain, and we see a lot of knee pain. Now, knee pain can be very frustrating because it can keep you from doing the things that you want to do, and it can often become chronic, meaning it stays around for a long period of time. Now, the knee seems simple enough. It's a joint that flexes and extends. There's not a whole lot of movement variability going on there, but it is this joint that is stuck in between 2 more complicated joints, the ankle and the hip. So whenever we're dealing with knee pain, we have to look above and below. If there's something going on that is not right or dysfunctional above or below the knee, it can overstress that joint and lead to injury. So that brings us to our 4 overlooked causes of knee pain. We're going to summarize them right now, and then we'll go into each into more detail. The first one is ankle inflexibility. The second is hip inflexibility. The third is poor single leg stability or balance. And the fourth is knee pain that is the result of a spinal source. And we're going to talk about what that means at the end. So the first often overlooked cause of knee pain is ankle inflexibility. Now, unless you're sitting on a chair and straightening your leg out, anytime you move, your ankle is involved with knee movement, right? When you walk, your ankle moves to allow your knee to move. When you squat, when you run, the same thing happens. So if you're limited in flexibility in your ankle, your body is smart and it knows that whatever task it's doing, it needs a certain amount of mobility. It's going to steal that mobility from the next nearest segment. So let's take the squat, for instance. If you're squatting and you lack flexibility in your ankle, you're going to start putting more stress on your knee. Same thing when you're walking or running. We want that flexibility in the ankle, so we're not putting more stress on the knee. In this case, we have knee pain that is not a knee problem, it's an ankle problem. So it's important to look at ankle flexibility. Here's a test that you can do to see if your ankle is moving properly. You're going to get into a kneeling position with the ankle that you want to test in front. Then you're going to take a fist and you're going to put the pinky side of your fist against your big toe and the pointer finger side of your fist against the wall, and you're simply going to try to lean your knee into the wall. Okay, you want your foot to remain flat and you want your knee to be able to touch the wall without your ankle or without your heel coming off the floor. If you can do it, great, your ankle is moving perfectly. If not, you lack some ankle flexibility. The second overlooked cause of knee pain is hip inflexibility. Similar to the ankle, if the hip is not moving properly, it can put excessive strain on the knee joint. So the hip moves in a lot of different planes of motion, and there's a lot of ways we can test this, but a real simple way is going to be to lay on your back, bring the foot of the side of the hip that you want to test up to your opposite knee, and you're simply going to let your knee fall off to the side. That knee should come within a fist or 2 distance from the floor. If that knee is hovering up in the air like a chicken wing, your hip is a little tight and it could be the result, or it could lead to knee pain, and you want to work on your hip mobility. Now, the third overlooked cause of knee pain is single leg instability. Now, this is a big one, especially for runners, but really for a lot of people because we have to walk, and walking involves standing on one leg at some point in the gait cycle. So we want to make sure that when you walk, you go down the stairs, when you run, that you are stabilizing through that one leg appropriately. Now, if you can't balance or stabilize appropriately on one leg, you could be putting excessive force or stress through the knee, which can result in knee pain. Let's take running, for instance. If you're going for a 5-mile run and every time your foot hits the ground, you are not stabilizing appropriately, that is however many steps per mile per that 5-mile run of putting excessive force on the knee. So here's a way to test your single leg stability. You're going to stand on a surface that's about 6 inches from the ground, and then you're going to put your hands on your hips, eyes straight forward, and you're going to try to tap the opposite heel to the ground lightly. okay? You're gonna try to tap that heel to the ground lightly. Ideally, you're in front of the mirror so you can look and see how your leg is behaving. You want that stance leg to remain nice and straight. You don't want your knee to cave in, you don't want your ankle to wobble or anything like that. If you can do 5 to 10 reps of that, no problem. That's great. If you have trouble, you could have issues with your single leg stability. The fourth overlooked cause of knee pain is knee pain that is the result of a spinal source. So this is knee pain that is caused by something going on in the spine. Now, did you know that you can have extremity pain? That's pain in the elbow, in the hip, in the knee. That is the result of a spinal source without any spine pain at all. They actually did a study to figure out what percentage of patients fit that criteria. What percentage of patients had knee pain that's the result of something going on the spine in the absence of spine pain. And they found that that number is 25%. So that's pretty significant. So if you're someone who's been dealing with knee pain for a long time and you've been from doctor to doctor and you just haven't gotten the answers that you want to, your knee pain might be the result of something going on in your spine. So that's going to be important for you to check out. Now, in the previous examples, I gave you ways that you can assess yourself to see if your ankle's moving well, your hip's moving well, or you're stabilizing appropriately on one leg. Unfortunately, spine pain or extremity pain as the result of spinal dysfunction is a little more nuanced. You're gonna need to see a trained medical professional to try to rule out any spinal source of extremity pain. So if you're dealing with knee pain as a result of any number of the issues that we talked about today, we would be happy to help. Please visit us online at TruMotionTherapy.com to learn more or to schedule an appointment.